Okay, checking in for day 9, and today I'm doing much better. The swelling is going down quite rapidly. I was looking at myself in the mirror today, and I really like how my temples are starting to fill out, because when we hollow in our temples, it really shows our age. It starts to like skeletonize us. So it's nice to have some volume in my temples again. The brows are still struggling a little bit. There are a lot of swelling, and that's basically what the swelling is at this point. The doctor was in different planes of the tissue when he was inserting the fat. So that's what we're seeing right now, is just residual swelling. He says that the fat transfer takes relatively quickly. And I do want to talk about the dry eye issues today. What actually happens, and if you think about it, you're cutting open your eyelids, and then you're cutting off skin, like excess skin, and then you're stitching the skin back together, which causes a wound. If you've ever had a cut, you feel how it's hard for quite a while. And that's exactly what's happening with my eyelid. Last night when I was gently pulling down on my eyelids, I'm not touching the wound area because I'm not allowed to for another 6 or 7 days. So I was just gently pulling down on my eyelids. That's the massage therapist in me. That's like my instinct is to do that. And I felt a pop, like my eyelid was kind of stuck in that position where the stitches were in the skin. So pulling on my eyelids like that, I think it just helps to release the fascia, and my eyelid could close a lot better. So what's happening is my eyelids aren't closing all the way. And that is the risk that you run with this type of surgery. If your surgeon takes off too much skin, you can't close your eyelids all the way. So there's this fine line that they have to walk and not take too much skin, because otherwise you're going to suffer with dry eyes the rest of your life. He did tell me it's going to resolve in 1 to 2 weeks. Once that skin starts to soften up and I'm able to massage the suture site, the tissue is going to start to release, and I'm going to be able to close my eyelids the whole way. So I did take the most unflattering image ever, and I'm going to go ahead and pop it up, because you can see that I'm not able to close my eyelids all the way right now without pressure and squinting. So that's what my eyelids are doing right now. So it's not going to be like LASIK. LASIK was a terrible, horrible recovery for me with dry eyes. And I didn't really understand that I had dry eyes until I got LASIK surgery. I still struggle. It's been since June 2021 when I had my LASIK surgery, and I struggle with the dry eye issues considerably. So I'm no stranger to dry eyes. In my opinion, LASIK is worse for dry eyes than upper eyelid surgery is. This will resolve. I'm not worried about it. I trust my surgeon. He's got the experience. That is why I went to an oculoplastic surgeon. So for the comments saying that this causes dry eyes, temporary. So it's not lifelong unless your surgeon takes too much skin. The thing that I'm happy that I did before the surgery was I'm happy that I did the eyelash perm and the tint, because I haven't been able to wear mascara, and I can't tell you how excited I am to go back to the City Beauty Beyond Mascara. This is really, really, really good, and I actually secured a discount code for you guys. I'll drop it down below. And as of now, I'm going to start returning to my Revive Lash Lash and Brow Serum. I love this serum because this doesn't contain any prostaglandins or any prostaglandin analogs. This is all natural. This is growth factors, stem cells, and peptides, and it does really work. I need to do a dedicated video on this Revive Lash, and I also have a discount code on this. And the reason why not having the prostaglandins or the prostaglandin analogs, so think like your Latisse, that is a prostaglandin. And then if you think like Babe Lash, Hello Skincare, Grande Lash, like all of those over-the-counter lash serums, they can cause fat loss around our eyes, and that's the last thing we want. I especially don't want that, just because I just had fat grafted around my face. So I stick with a product that is not going to cause my iris color to change, and it's not going to cause fat loss around my eyes, which is going to make our eyes appear older and age. So I will link this. I love this stuff. It really does work. I do have before and after photos that I'll insert, but let's go ahead and get in close and wrap up day 9. So I think I'm healing quite nicely. And I did order New Gel Plus, I believe, that has a sunscreen in it when I can start using the Scar Gel in 5 days. But I am starting to see some hollowing at the top of my cheek right here. Not so much on this side. So it's going to be interesting to see if I think that this fat grafting is worth it. I'm not expecting miracles. I just wanted to reverse some of that aging, not have hooded eyes anymore, and fill some of that hollowing without using filler. So for tomorrow, I'm going to wrap up this mini series on my eyelid lift surgery, and we're going to go through the whole timeline of the 10 days. I think at this point, I am comfortable going back to the office because I've healed really quickly. This is day 9. That's pretty amazing. All right, I will see you in the next video. Bye.